4. Like, start.
Good afternoon, everyone. Hi, this is Dr. Gayatri Satpathy this side. I am consultant at Oasis Fertility at Bhubaneswar. Today, we are going to discuss and know everything about egg freezing. So, egg freezing is a very important topic for present day time because all women, and it is a very important step to achieve women empowerment. Women can decide when they want to plan a pregnancy, when they want to attain motherhood. So, that is through egg freezing, and it is important to know the complete details regarding the egg freezing, like what is egg freezing, what is the procedure, what are the costs involved, what are the risks, and also let us clear all your queries regarding egg freezing. So egg freezing, which is also in medical terms, it is called as oocyte cryopreservation. So oocyte is the medical terminology for egg, and cryopreservation means the cryo word is for the ice, and preservation is the storage. So when you are storing the eggs at a very low temperatures, it is called as egg freezing or oocyte cryopreservation. It is a process in which the woman's eggs are extracted from her body and then they are frozen and then they can be stored as a method to preserve the reproductive potential of a woman. So let's understand from when actually the egg freezing started. So it was the first birth using a frozen egg was reported in 1986. And over these 37 years, the egg freezing has advanced greatly with regard to the technology now that we are using. And so the overall success with regard to the egg freezing program has improved a lot. So, who needs egg freezing? So, when the egg freezing was initially started, it was for those women who required the freezing of eggs because they are going to undergo any form of cancer treatment. The cancer treatment could be medical therapy or it could be a surgery also. The medical therapy, like the cancer chemotherapy and radiotherapy, are generally toxic to the ovaries. Also, when surgery is required for cancer, most of the times a part or whole of the ovary is requires to be removed. So in these conditions, these women should can avail the egg freezing and they can store their eggs. So post their main treatment for the cancer, they can utilize these eggs and get pregnant. So it was for this indication that it was initially introduced, and this was called as fertility preservation. So later on, then there were other many indications that started coming up, and for now for many reasons we are doing egg freezing. So let us know one by one. So as I mentioned, women with cancer because chemotherapy or pelvic radiation affects the fertility. Second, any kind of surgery which can cause damage to the ovaries. Now, surgery can be for endometriosis, surgery because there could be some cyst in the ovaries, or surgery because there is some form of cancers or any kind of borderline tumors in the ovaries. So, again, these things can cause loss of the ovary or loss of eggs in the ovary. The third is whenever a woman has a risk of premature ovarian failure. Now, there are certain genetic conditions. For example, there are conditions like Turner syndrome, fragile egg syndrome, or if there is any family history where there is a very early menopause in the females of the family. So, these women are at risk of premature ovarian failure. That is, before time, before the age of 45 years, they may undergo menopause, they may lose all the eggs in the ovary. So it is better if they are not married or if they are not prepared to have a child at that particular point of time, they can go for egg freezing and then later on they can have a child whenever they require. And the other category is women who have ovarian disease. The most common is endometriosis, and because endometriosis is a chronic condition, it affects the ovaries, it affects the number of eggs, it affects the quality of the eggs. So these women can go for egg freezing. Then genetic mutations. There are certain form of genetic mutations in females, such as most common like BRCA mutation. Now, these mutations, especially BRCA, can cause cancer in the breast and the ovaries. So, when women have such kind of mutations in them, so it is advised that they go for the removal of the ovary before they are getting affected by the ovarian cancer. So, before they undergo surgery, it is better that they go for egg freezing if they have not completed their family, and then go for the removal of the ovaries. And the last most common indication now, which most people are aware, that we have something called as the social egg freezing, or which is also called as planned egg freezing, where it is because it is not because that women have any diseases or they are having any family history of any disease. It is because they are willing to go ahead for egg freezing because at this particular point of time they may be busy with their career or they may be busy with their studies or they might not have found the right partner for them. So let us now understand what is the procedure of egg freezing. So the procedure starts with a consultation with a fertility specialist, and then you have the second step, which is ovarian stimulation. The third step is the egg collection, which is also called egg retrieval or OPU. OPU means ovum pickup. Ovum is again the short form for a medical terminology for egg. And then the last step is the egg freezing part. So, when we start with the fertility consultation, the fertility specialist takes a detailed history of the woman who has presented herself for the fertility for the egg freezing. So, we want to know details regarding any medication that she is presently on. What is the reason for which she is wanting the egg freezing? Because women who are planning cancer treatment, they generally have very less time in hand. So we have to plan the procedure in a very short time, and sometimes we have to plan different types of stimulation protocols for these women. Then we also ask regarding what was the any past treatment history. We want to know any family history of any kind of diseases running in the family. So after knowing detail about the woman, we do an examination for the woman, and also it is very important for us to know the ovarian reserve of the woman. Now, ovarian reserve means what is the number of eggs that are present in her ovaries. So, as we all know, with age, the ovarian reserve decreases. So, at the age that she has presented to us, what is ovarian reserve can be known by a few tests. The most common test is the AMH test, which is a simple blood test, and then the other important test is the antral follicular count. Antral follicular count is measuring the number of follicles in the ovaries using a vaginal ultrasound. So, based on these antral follicular count, the AMH test, and the age of the woman, the right stimulation protocol is decided. So, the second step is the ovarian stimulation. So, what happens is in a natural cycle, that is normally for every female, every month one egg grows and then it gets released. But when we are doing an ovarian stimulation for the purpose of egg freezing, we want to have more number of eggs so that we can store more number of eggs for the woman. So how do we get more number of eggs? It is by giving the same hormone which gets released every month in our body. So the same hormone is given in a larger quantity. So these are hormonal injections. So these injections are generally given for a period of 10 to 12 days. And so most of the times these injections are started from the period day 2 or day 3 of your periods. And then we give these periods injections for 10 to 12 days daily. And once the eggs are reach to a particular size, so then the important step is the egg collection procedure. So as I told you, most of the times the egg collection, the injections for the stimulation of the ovary starts from day 2 or day 3 of the period. So this is a conventional stimulation which is done for most women. But then there are certain women who do not have much time in hand because they have to undergo any cancer treatment. So for them, we can also choose for random start stimulation. That means irrespective of the day of the cycle, on any day we can start the stimulation and then plan the egg collection. We also have certain other advanced stimulation procedures like dual stimulation, which is also called duostim. So what happens in this is that we can stimulate the ovaries twice in the same month. So normally in a conventional stimulation, only one stimulation is done in a month. But when we do a dual stimulation, we can do two stimulations in 1 month so that we can, in a short period of time, we can get maximum number of eggs for a female. And then we also have another advanced technology called as IBM, which is also the full form is in vitro maturation. So the advantage here is that very few injections are given, generally 4, 5, or 6 days of injections only, and then the immature eggs are taken out from the woman's ovaries. So because these are immature, now they are grown in the lab, and the eggs get matured inside the lab. Once the eggs are matured in the lab, they are then frozen. So the advantages again for women who have very less time, it is a very advantageous. Or women for whom 10 to 12 days of injection is not suitable because of their disease condition, again for them it is very advantageous. Third, there are certain women who do not want to have such a long stimulation, even 10 to 12 days injections they do not want to take. So they can take a very short duration of injection and go for IVM. The third important procedure is the egg collection. So once after the stimulation is done, whichever stimulation has been done, we wait till the eggs are reach to a particular size. Now the eggs have to be taken out from the woman's body. So how this is done? It is done through a short surgical procedure. It is done under general anesthesia. Now there is no, it is not a major abdominal surgery. There is no cut on your abdomen. The surgery is done through the vagina, and through the vagina the needle is inserted, and the follicles are aspirated. The follicles are tiny little water bags where the eggs are present. So these are aspirated, the eggs are taken out. So because it is done under general anesthesia, the women are completely comfortable and there is no pain. Post the procedure also, women are fine. They are discharged on the same day after 2 to 3 hours of observation in the hospital. Next day onwards, women can do their routine activity and they can also go back to their work. So the after the egg collection procedure is done, now the important procedure is the assessment of the egg quality, which happens inside the lab. So our trained embryologists in the lab, they observe the eggs which have been collected under a very high power microscope, and they observe the quality and they also assess the maturity. So there can be immature eggs, there can be mature eggs which have been collected. So I have shown you a picture also in this. You can see the top one is an immature egg. Immature egg means it is an egg, but there is no polar body. In a mature egg, there is a polar body. So these things, fine differences are known under the microscope, and because we want to store only the mature eggs, because only the mature eggs can fertilize and give you the embryos. And the final step is the egg freezing. So once we know the quality of the egg, we know the maturity, so we have taken out all the details. Now these eggs are stored under the name of the female from whom it has been taken out. And they are stored in small cryotubes. And these cryotubes are dipped inside liquid nitrogen and at minus 196 degrees Celsius. And once stored inside liquid nitrogen, they stay in the same condition for years together till you take it out of the liquid nitrogen tank. So now, how are you going to use these eggs in the future? So in the future, when the woman is ready to plan motherhood, she comes to us, and when she has a partner with her, so we take out these eggs and we inject each egg with the sperm of the partner of the female. So this procedure is called as ICSI. ICSI is short for intracytoplasmic sperm injection. So inside every egg, we have to know how many eggs have fertilized. So that means how many eggs now have gone towards the process of embryo formation. So after injecting the sperm into the eggs, we need to give some time for the embryos to form. So it is on the fifth day that the embryos known as blastocysts form, and these are day 5 embryos, and we store these blastocysts, or in the same cycle we can transfer these blastocysts. So this procedure is a final step, which is known as the embryo transfer. Once the embryos are formed, they are transferred inside the uterus of the woman, and after 14 days, we get to know if she is pregnant or not. So let us know certain answers to certain questions which are very commonly asked to us by the women who opt for egg freezing. So what is the right age for egg freezing? So the answer is the better, the earlier, the better. Because at a younger age, most women have more quantity of eggs, and also the quality of the eggs is also better. But as the age advances, particularly after 30 and especially after 35 years, not only the quantity of eggs come down, but it is also the quality of the eggs which start becoming very poor. So the best age would be between 20 to 35 years of age for the egg freezing. Again, now the next important question is what are the chances of a successful pregnancy using these frozen eggs? So there are important factors which determine what are the chances of success. The most important factor is the woman's age at the time of egg freezing. The second important factor is how many eggs we have got and stored for the woman. The third is what was the reason for the egg freezing and what was the method of egg freezing. Now, reason of egg freezing, because if some women have any genetic reason or any cancer issues for which she has undergone egg freezing, maybe the any particular diseases could affect the egg quality. For example, sometimes endometriosis can affect the egg quality. But if she has done only social egg freezing, that means there is no diseases, but she has only opted because she wants to delay the motherhood, then in those cases most of the times the egg quality may be good if she is of a younger age. Then the method of egg freezing, this is also important, because in the initial years when the egg freezing started, the method which was used was slow freezing. Now we are doing vitrification very commonly. Vitrification gives more superior results with regard to the outcome of the egg freezing. Now, as I mentioned you, the most important factor which determines success is the age of the mother, because as you can see in the graph, the younger the age of the mother, more eggs can be retrieved. So when she is less than 35 years, so approximately somewhere between 15 to 20 eggs can be taken out. But as the age increases above 35, the number of eggs come down. Again around 40, the number of eggs are around 10, then 9, then 7. So both the quantity and the quality is coming down, and that is why the live birth per IVF cycle also comes down as the age increases. So we emphasize on freezing the eggs at an early age. But the other important question is, what are the pregnancy rates with egg freezing? So if you want to understand the live birth rates or clinical pregnancy rates, it is somewhere around 5% per egg. So roughly, if you have around 20 eggs, you have a reasonable chance that you are going to take home a baby with you. So again, very important query is among the mothers, among the women, are that doctor, is there going to be any effect on the baby if it has been born through a frozen egg? So it has been around from 1986 till now, around 37 years have passed, and so many babies have born worldwide through egg freezing. And whatever the available data, the literature, that has not shown any increased risk of any kind of birth defects or congenital abnormalities in these babies. So now, again, this is very important to understand. What is the risk which is associated with egg freezing to the woman who is undergoing this procedure? Now, there is the risk. What I'm going to tell you is very low. Actually, these are all theoretical risks. Practically, we are not encountering these nowadays. So one is small risk of OHSS, that is ovarian hyperstimulation syndrome. So when a woman develops a lot of eggs, sometimes some ovarian hyperstimulation syndrome may develop, where a woman may develop symptoms like bloating, pain, vomiting sensation. So some these things are common, and most of the times these can be controlled also with medications. And now also, because of better quality injections and better type of injections, we are able to reduce the extent of OHSS to a large extent. Then there can be a minor risk of infection and bleeding, but it's very less likely, because we are also doing the procedure under anesthesia, a short procedure, and then also giving you antibiotics and painkillers. So you are actually comfortable, and very less women complain of any kind of pain also post the procedure. Again, now what is the how many eggs to be frozen? Very important to know, so that you have a reasonable chance that later on in life you will be able to have a live birth. So if your age is on the lower side, less than 38 years, you may freeze even lesser eggs. So around 15 to 20 eggs is what we are looking at. So if in one cycle we are able to get those many eggs, so then we are happy, because with the 15 to 20 eggs, each egg has around 5% chance of giving you a live birth rate. So 20 eggs means you have a around 190 to 100% chance that baby take home baby rate is good. And if you have more than 38 years, we would like to have more number of eggs from you, because as the quality of the eggs comes down, so at least the quantity should be more, which can compensate for the decrease in the quality. So more than 38, around 25 to 30 eggs is what we are aiming for. Now, how long can the eggs be stored? So once the eggs have been dipped inside the liquid nitrogen, these eggs remain in the same condition, and they can be stored there for years together. But by the government guidelines, once the eggs are stored, we need to utilize them within 10 years. Now, the very important question in India, because most of the insurance companies are also not having this benefit of providing egg freezing. So most of the times, women have to pay this out of their pocket. So let us understand what is the cost breakup. So the egg freezing cost includes the cost for the injections which are given for the ovarian stimulation. The second cost is the storage part, like for how many years you want to store, and also the lab charges goes into that, because in the lab we have to remove the outer layer of the eggs and dip inside the liquid nitrogen. So all those costs is involved. And the third is the procedure, because the egg collection has to be done under anesthesia in the operation theater. So the OT charges and the anesthesia charges are involved. And for the number of years you want to store, the more the number of years, again yearly the storage charges also add up. So roughly somewhere between 1 to 2 lakhs is the cost for egg freezing in India in most centers. So what are the benefits of egg freezing? So first benefit is that you can focus on your studies or career if you're planning a egg freezing, and because you are at least assured that you can have a motherhood later, so your fertility anxiety is going to reduce. You can take your own time to find the right partner for you, and you can also protect your eggs from any kind of treatment induced reduction in the ovarian reserve. That is, those women who are going to have any kind of surgeries or any kind of treatment which can harm their ovaries, have a consultation with a fertility specialist and go for fertility preservation. Is egg freezing covered in insurance in India? Most insurance companies do not cover egg freezing, but then there are a number of companies which are giving support to their female employees for egg freezing, like Accenture, Myntra, SAP India. So they are all supporting the female employees who opt for egg freezing. We know many of the celebrities also, they have broken the stereotype. They have openly discussed that they have gone for egg freezing. For example, Priyanka Chopra did her egg freezing when she was at her 30s, and now she has a child with her in her late 40s. So the thing, the message that I want to give you is that you do not have to be a celebrity to go for egg freezing, because now egg freezing is easily available. It is a very good technology available in most good IVF centers, and so you can also avail egg freezing, and you can also plan your motherhood according to your desire. So my final take-home message is that elective egg freezing is an empowering choice, but only if you have the appropriate information to make it. So the basic idea, the whole purpose of doing this webinar today was to give you the right information about the whole of the procedure, the risk involved, and also I have solved the basic queries which are commonly asked by women who go for egg freezing. So take the right decision for your life, and I'm now happy to answer any questions if there are by the audience. Thank you. So, what is the best age to freeze your eggs? So, as I mentioned, the earlier the age, the better it is, because as the age of the woman increases, the quantity of the eggs come down, the quality of the eggs come down. So, we would be more happier if we can freeze the eggs at less than 35 years. So, 20 to 35 years is the best time to freeze your eggs. So, what are the advantages of egg freezing? So, as I mentioned, the advantages are, apart from those women who are have to do egg freezing for fertility preservation. So, even if you have to undergo any treatment that are going to affect your ovaries, you will be at least assured that you now have eggs which you can utilize in future and you can get pregnant. And second advantage is those women who are going only for social egg freezing, that is without any reason they are going for egg freezing. So now you can plan your career also. Once you are in a well settled position in your life, then you can plan motherhood. And also there are many women who are now single and they have not yet chosen their life partner. So then if you store your eggs, and then later on you can form embryos using the sperm of your partner. So these advantages make you feel more empowered. How many eggs should a woman freeze? So ideally, around 15 to 20 eggs is what a woman should freeze if she is around less than 38 years. But if the age is in case more than 38 years, sometimes we may have to freeze 20 to 25 eggs. So these were the some of the questions that were asked, and any other questions, please ask us in the comment section, and we would like to reply you back. And thank you so much to all of you who have attended this webinar today. Thank you so much.